how to choose the best health insurance plan for you and your family. The other day, I've talked with a very nice person who called me to speak about picking a health insurance plan for his family. This conversation inspired me to record this video. The guy makes his money as a stand-up comedian, and I surely was entertained while advising him on his health insurance options. He was like, I know nothing about this health insurance business, but I want the best health insurance plan for my family. He said, it's confusing like nothing. And he goes like, let me tell you a joke so you understand how I feel about shopping for health insurance. And let me tell you the joke that this guy told me. Hopefully it's going to be entertaining. So one man calls the clinic to get results from his wife's blood tests. On the other end of the line, the doctor asks him, what's your wife's name? And the guy says, her name is Sarah Cohen, replies the man, right? The doctor examines his medical records and says, on the day of the examination, I had 3 patients with this name. Maybe you have her ID number. No, replies the man. Well, says the doctor, I'll tell you this. One woman has heart problems, one has Alzheimer's, and the other one has AIDS. Jesus Christ, how can I know? The man asks anxiously. It's simple, replies the doctor. Send your wife to run around the building, and if she comes back, do not sleep with her. Got it? Send your wife to run around the building, and if she comes back, do not sleep with her. Anyways, that's the joke. Now let's move on to the... Okay, so today I will try to make sense of all this health insurance business, as I'm sure many people are confused as well. In this video, I'll give you a step-by-step guide to choosing a health insurance plan that will work best for you and your family. First of all, you have a very limited time to choose your health insurance that should work for the entire year. So you don't want to get yourself into a wrong arrangement and then have no other way of switching to another medical plan in the middle of the year. So while the open enrollment is open, use all the resources and research the best options for you and your family. I really advise you to find a licensed independent insurance agent and consult with a professional before you make a choice, a decision. Insurance agents don't charge for their services, and you don't pay more for your insurance plan if you work with an agent. Agents are a tremendous resource, but be careful. Check if the professional is licensed and independent, so you don't run into someone that has no license and is selling you some sort of garbage. Okay, so be careful. If you're still determined to enroll on your own, decide if you want to enroll on the private market, if you qualify for a reduced premium plan via exchangers, or if your employer provides insurance and you don't have to deal with plan selection at all. If you are shopping for an individual medical plan and you qualify for advance premium tax credit, you can go to your state exchange website and run a comparison estimate or a quote. This is relatively easy to do. You can just type in your zip code, your age, and income, and you get a list of various insurance plans with details. So how do you make sense of all these plans? Well, first, sort it out by cost and compare a few plans from each category. Select a bronze, silver, gold, and a platinum plan. If you are going to the doctor once or twice a year, there is no reason to get the most expensive medical plan and overpay. If that's the case, go back and compare bronze and silver plans and look for details such as deductible, copays, coinsurance. If you have no idea what I just said, feel free to watch my detailed videos where I explain exactly what this is and how it works with different plans. Another important thing to watch for is the type of medical plans. You probably heard about PPOs, HMOs, EPOs, POS, and so on. All these abbreviations are usually next to the name plan and actually are important. For example, if you have an HMO plan, which stands for Health Maintenance Organization, you are required to stay only in network and will need a referral from your primary care doctor if you need to see a specialist. On the other hand, a PPO plan, which stands for Preferred Provider Network, does not require a referral. One very important aspect to consider when shopping for health insurance is who takes this plan. You really want to know ahead of time, before you apply for health insurance, what doctors, clinics, and hospitals are in network with your health insurance. If you don't do this in advance, you will end up using your insurance out of network and will end up paying out of network as well. In other words, you'll pay the big bucks for nothing. Also, don't leave money on the table. If you work hard, pay taxes, and are doing all you can to support the family, make sure you don't overpay for your health insurance. It's really easy to check if you qualify for a subsidy. You can go to your exchange, just like the state-run exchange website in your state, or talk to your agent. In California, you can go to coveredca.com or talk to me. I am an insurance agent in California, and I love helping people. So these are some of the points you should consider when buying health insurance. If you have questions, please feel free to reach out. As always, please support my efforts by simply liking my video or commenting your thoughts under this video. This does not cost you a dime, but it tremendously supports my channel. Thank you.